My name is Susan Rosenthal. I live in Durham, North Carolina. I was probably struggling with urinary incontinence for about 2 years. You know, it was something that I had never thought about, and then I thought about it all the time. I did not want to live with this problem for the rest of my life.
Up to half of all women at some point in their life will face incontinence or some other pelvic floor issue. And the frustrating thing is that many people feel like it's just a normal part of aging and they have to deal with it. Part of our message is that there are options, there are things that we can treat, and that's what we do every day. We see lots of women with these problems.
After the surgery, when I saw how amazingly well it worked out, I thought, why in the world did I wait so long to do this?
Quality of life is important to our patients, and it's important to us. What I enjoy most is talking to a patient in the clinic, telling her that there are some treatments that are available that can make a big difference.
You couldn't have a better experience than you will have at Duke. I'm 100% convinced of that. The incontinence seems to have disappeared. It's like a miracle.
At Duke Urogynecology, we specialize in treating women with pelvic floor disorders. Pelvic floor disorders include urinary incontinence, bowel incontinence, and pelvic organ prolapse.
We have 2 convenient locations, both in Durham and in Raleigh. We're completely patient-focused. From when we were designing the building, the convenient parking out front, to the way the flow of the office is inside, to scheduling so that patients can get back to work or to their families.
When a patient comes for the first time, the patient sits down with the physician and we discuss the concerns the patient has, any other treatments they've had in the past. Then we do a pelvic exam, and after the pelvic exam, we determine whether or not additional tests need to be done, and then the patient and the physician will sit down and talk about a treatment plan.
We offer a variety of treatment options, from dietary and behavioral modifications, physical therapy, office-based procedures, medications, and surgery.
My name is Dorothy Lowell. I'm from Fayetteville, North Carolina. I lived with incontinence for approximately 5 years. I decided to go the route of the InterStim.
InterStim therapy involves placing a wire near the nerve that goes to the bladder. The patients test the device out, and about 8 out of 10 patients will have a significant improvement in their incontinent episodes during the testing phase.
It's really a simple procedure, and it will make such a difference in your life. Do something about it. You'll be very happy.
My name is Gail Hooser, and I live in Raleigh, North Carolina. I started having problems probably about 1.5 years before I had my surgery.
Here at Duke Urogynecology, we are specialists in the treatment of vaginal and pelvic organ prolapse. Prolapse is a condition caused by a weakening of the muscles and tissues of the pelvic floor that can cause organs such as the bowel or the bladder to drop down into the vaginal space.
I had a lot of discomfort in the bottom part of my stomach and pain. And if I sat a long time, it really bothered me, or if I were on my feet a long time, it bothered me a lot. When I went to have my surgery, the staff was just wonderful. They took very good care of me. I wasn't there very long. I opted for the robotic because everybody had told me that was the easiest way to go.
People often ask, what's the benefit of robotic surgery? The bottom line is that we can perform the same procedure as we do open with enhanced high-definition vision, with incredible precision through small incisions, less pain, get patients back to work faster, back to their families faster.
The only place I was sore was where my incisions were, and the little incisions healed in just no time. I just feel so much better as all over since I had the surgery. And everyone told me I would, and I didn't believe them, but other than getting rid of all that pressure and the discomfort and the pain, I just felt, I feel good all over.
I think our practice is very unique. We have 5 fellowship-trained physicians who have completed advanced pelvic surgery fellowships. We train our own fellows, and we also educate the OBGYN residents. It's a great practice environment.
So probably the best part of our practice is our nurses. They basically take patients that come in with very personal problems and make them feel very comfortable from the moment they walk in the door. We're really lucky to have them. You know, the nice thing about what we do is that in our office is that patients can come in and actually talk about these things that are bothering them that many of us take for granted, right? If they're working right, we don't really think about it. But when they're not, there aren't usually a lot of places that you can go to discuss it to try to figure out how you can make it better. That's what we're here for, is that we want to have patients walk in the door, feel comfortable telling us all their problems related to these conditions or the things that they're experiencing, and feel that they can tell us anything.
I think many women suffer in silence. They feel like they're the only one that this is happening to, and that is not the case. There are so many women out there who struggle with these issues, and we're here to help. And we really want women to come and seek therapy because there's a lot that we have to offer.